Nutrition and fluid balance. These patients are going to need either enteral or parenteral feeding. They're not going to be eating. They're on a ventilator. We want to keep our pulmonary fluid volumes as low as possible without compromising cardiac output and blood pressure. So they're going to need fluids if they're volume depleted and diuretics if they're volume excessed. Kind of play it by ear there. Medical supportive therapy, we want to maintain cardiac output and tissue perfusion. They're going to have continuous hemodynamic monitoring. Because of the hypotension, they usually get an arterial line, to monitor blood pressure. They may have a pulmonary artery catheter inserted for fluid management. That's a catheter that goes in through a central line. It's threaded through the vena cava, superior, inferior. Inferior if you're coming from the groin, but we don't like to use the groin. So subclavian, IJ, threaded through the superior vena cava into the right atrium, right ventricle. It sits in the pulmonary artery. From that, we can measure various pressures and make determinations about what this patient needs. We may need inotropic drugs to help the heart pump. And then hemoglobin, we usually keep it at a level of 9 to 10 with a SAT greater than 90. You got to have carriers to carry the oxygen around. Wow, now that's ARDS. It's a very complicated disease process, and once it happens, there's really nothing we can do except support the patient through it and do everything we can to prevent complications. Families need a lot of support. The patient will be sedated, pretty much unresponsive in this situation, and explaining to the families that this is a consequence of something else, and this is the way the body responded to the insult. It's a hard thing to wrap your head around. All right, now we talk about things that kind of are fluffier. We're going to look at the non-infectious irritants, namely foreign body aspiration, smoke and inhalation injuries, and submersion injuries. Okay. Foreign body aspiration, we are concerned about airway occlusion, partial or complete. Remember the signs and symptoms? With a partial airway obstruction, you may hear wheezes. With a complete, again, it's hand to the throat and inability to speak. The treatment will be your Heimlich maneuvers. If that's not successful, emergency tracheostomy to produce an airway and bronchoscopy to clear the airway occlusion. Thing I would add to this is in preschool children, we shouldn't be giving them nuts or popcorn for fear of aspiration. Inhalation, smoke and inhalation injuries. They can cause hoarseness. They can cause a chemical pneumonitis, pulmonary edema, and ARDS. Carbon monoxide poisoning is a special gas that is odorless. People don't know that they're being affected by it. Signs and symptoms can include things like headache, confusion, trouble breathing, nausea, visual disturbances, irritability, hallucinations, coma, death. The thing about carbon monoxide poisoning, even if the patient recovers, there's often neurological damage that results, even though they may not have even needed a ventilator. But carbon monoxide it is not good for the brain. It's not good at all. The treatment for carbon monoxide is 100% humidified oxygen. You're trying to displace the carbon monoxide. It's problematic because carbon monoxide adheres itself to hemoglobin much more readily than oxygen does. In a patient who has a smoke inhalation, it can produce an injury below the glottis that will have clinical manifestations not for 12 or 24 hours, so you don't see manifestations for a while. That's why people who have burns to the face, neck, anterior chest, and smoke inhalation, even without burns, need to be monitored, and you have to consider respiratory trauma. Now certainly, if the patient looks like this, with obvious burns to the face, we get it. But sometimes the patient looks like this, or may even be talking to you and says, you know, I'm okay, I'm all right, yeah, I got a little bit of smoke, but it'll be all right. A thermal injury occurs above the glottis and causes redness, blistering, and edema. Mechanical airway obstruction can occur quickly. Mechanical airway obstruction. So this edema, if this edema occurs in here, my airway shuts down and no air moves.